arrived at Reading Hospital as a 23-year-old dietitian, and I've had the remarkable privilege of seeing the hospital grow from a small 300-bed community hospital to a 700-plus bed regional medical center and system. In 2010, there was a change of leadership at the most senior levels of the hospital. When new leadership comes in, understandably, their need is to assess what's going on in the hospital and what it is they are now leading. Not unexpectedly, we were introduced to a team of consultants who came in to assess and evaluate each department in the hospital so they could report to the new leadership what was actually going on in the organization. It was a stressful time for us. The industry is full of stories of new leadership ushering in contract feeding companies and doing away with self-operations. We were understandably concerned. We were introduced to the consultants, and after speaking with them and sharing some information with them, it became clear to me that what they were looking for was actually available to them already. When I shared with them what was then the AHF benchmarking data, they were delighted to see that, wow, this is done. And they actually did take that data. I was able to produce it within 15 minutes, I think, and give them a year's worth of data. They took that. Understandably, they did validate that it was indeed accurate, but their report when they came back to hospital administration was that we have a very well-managed department.
And the other thing that benchmarking will do is at least get you to look at systems and dig into the numbers more to find out where it is you are going, and through that you can make various types of improvements.
We continue to consistently use the benchmarking data, and actually we're very, very fortunate in that 2011 the hospital administration recognized the need for a total conversion and renovation of the food service building. So we were absolutely delighted to know that we had the opportunity to renovate that building in 2011. So what followed then was a 2-year planning process and ultimately an 18-month-long total renovation of the entire building. When we presented the final labor plan to hospital administration, their first question was, how will you benchmark with that level of labor? They were referring to how we would benchmark against the common industry-provided hospital benchmarks that are used throughout the nation. From a department-level user perspective, those benchmarks are notoriously unfriendly. The data is 6 months old when you get it, and there is no access to real-time data which lets you assess different compare groups, for instance, room service or no room service. I was able to document that Benchmarking EXPRESS had historically similar results to that other national standard, and that we could indeed rely on what it said. Turns out, ultimately, that we were right. We predicted we would come in between 0.13 and 0.14 man-hours per meal equivalent, which was then the 50th percentile. Because we could document that we thought 50th percentile was where we would end up, we were indeed able to get the level of labor we needed to get that project accomplished.
One of the other points that was great is that as we move forward with our room service program, we had various benchmarks presented to us for where we believed we were going to accomplish from a patient satisfaction standpoint, a cost of food standpoint. One of the things that was great is after several months of the food service program, by looking at those benchmarks, we demonstrated, one, we were able to reduce cost per what was expected, and more importantly, we saw patient satisfaction scores soar.
Since the completion of our renovation, we have continued to consistently use Benchmarking EXPRESS to document to administration the changes in our operational performance. What we have found is the negative impact on our labor, which would be fueled by the room service operation, has actually been softened by a corresponding increase in meal equivalents that have actually been driven by an increase in retail revenue and retail traffic that came about because of the extensive retail renovations. So we are exactly where we predicted we would be. We continue to hover between 0.13 and 0.14 man-hours per meal equivalent, which is roughly right now at the 40th percentile. We've also been able to demonstrate that the room service-driven reduction in food costs has actually led our total cost to decline in spite of our increased labor need. The additional revenue that's been generated by our cafeteria renovations has actually driven our net costs way down and our contribution margins way up. We're actually operating our retail areas in the black with contribution margins above the 75th percentile. And I am incredibly proud of the team that helps me produce those meals every single day.